If you struggle with burning pain or tingling in your feet, Front Range Medical Center's chiropractor can help. Dr. Dean Anderson shares how he can free you from peripheral neuropathy. Now, what is peripheral neuropathy?
So peripheral neuropathy is damage to the nerves on our periphery, so in our extremities. Most of the time, the nerve damage will happen in lower extremities, start off in the ball of the feet and the toes. As it progresses, it'll work its way up towards the knees. This can also affect upper extremities, so affect the nerves in our fingers, and again, as it progresses, work its way up towards the wrist. But peripheral neuropathy is damage to the nerves in our extremities.
Okay, and what causes peripheral neuropathy?
When patients come in, that's one of the main things we want to understand in the very beginning. And a lot of patients, when they come in, they've had neuropathy for years and they've been told it's idiopathic, meaning we don't know why. And I stress to those patients, there's always a reason, right? So the first thing you always look at is number one, blood sugar problems. That's the most common cause. And not just diabetes, but even prediabetes can lead to neuropathy, low blood sugar problems. It can be secondary to an autoimmune condition patients deal with, or chronic inflammatory problems. It can be side effects of certain medications. Certain statins can cause neuropathy at times. Long-term use of antacids can cause it. Chemotherapies are known to cause it. Liver, kidney problems. So then there's a long list of reasons patients have this. And again, in the beginning, we always want to really dig and figure out why, or at least narrow it down to a few things.
Okay, and what are things that patients have been dealing with?
Man, with neuropathy, it's usually like the nerve damage brings numbness, tingling, feeling like there's something in your shoe when there's not, burning pain, electrical pain, sharp pain. So a lot of patients deal with just a lot of discomfort. A lot of times symptoms are worse at night, so it really affects sleep. We have a lot of patients who have real mobility problems because of numbness. We don't know where our feet are in space, so balance becomes a real issue. A lot of patients who are fall risks, but just, enjoying activities, running around with grandkids, being able to travel, being able to hike and enjoy Colorado. Plus, a lot of patients deal with just kind of the depression and anxiety they have from, not knowing what's going on and the fact that it seems to be progressing.
Yeah, and you've mentioned that this does progress. Are there any long-term complications if it's not treated?
Yeah, typically as neuropathy progresses, it's what we talked about. It's increase in symptoms, it's decrease in quality of life and being able to enjoy things. Some patients really worry about like amputations and stuff. That can happen with very severe neuropathies, but they're few and far between. It's really in the beginning, it's all about making sure you address it sooner rather than later, because when we see patients, the more nerve damage they have, obviously then the more limited we are to be able to help.
Okay. You offer an advanced treatment, so what's your approach to peripheral neuropathy?
Sure. First of all, I always like patients to understand traditionally what's done with patients who have neuropathy is they're usually on like medications, gabapentin, Lyrica, and they can help with symptoms, but long term, they're not really doing anything for the nerve damage. It's not doing anything for what's caused it. So we see a lot of patients who are looking to get off those medications. We do a treatment in our office, Sam, that's the most advanced form of electromedicine. Nerves are electrical. With this advancement in treatment, we provide something called nerve re-education. We'll see significant reductions in the burning, sharp-shooting electrical pain, numbness subsides, so patients can get their balance back, feel more comfortable driving, be able to be mobile again, enjoy activities. There's ancillary therapies we're doing to help increase circulation to the nerves. And then back to what we talked about in the beginning, we also make sure we address the underlying cause. Because as we get nerves better, we have to make sure that blood sugar is better if that's the cause, inflammatory issues, autoimmune issues. So it's really this comprehensive approach.
Great. Well, you have many happy patients, and so let's hear from one right now.
My experience here at Front Range Medical Center is great. I have always felt comfortable with the staff. They've always been very transparent with everything and making me feel comfortable knowing about my whole treatment process. And coming in here each day made me feel just like a family member and that they were going to help me in any way that they could. I would absolutely recommend Dr. Anderson. I think he is doing great things for so many people, including myself, and I couldn't recommend him more and give hope to other people that are also feeling in the same position that I am.
I love seeing her smile.
Yeah,
Now
that's
tell us
great.
what makes your office unique.
You know, Sam, we have a ton of experience. I've been in practice for 20 years. This is the only condition we treat. And then the fact that what we do is very comprehensive. It's not just the advancement in treatment, but making sure we also address the underlying issues. That's what's going to give long-term success.
That's wonderful. Thank you so much for telling us about this today, Doctor.
Thanks, Sam.
Now, the first 12 people to call 720-881-9749 today will receive a free consultation, which is a $245 value. The consultation includes a review of your health history, a neuropathy-specific evaluation, and a review of past records to determine if you're a candidate for treatment. That number again is 720-881-9749 or visit denverneuropathy.com. Dr. Dean Anderson sponsored today's segment.